Hello, and welcome to HBW-TV. I'm your host, Sulin. Today, I'm joined by a very special guest, Ms. Zelnniezz Khoo, a consultant here at H Clinic with over 20 years of experience in her field. Today, we'll be talking about the skincare treatment post-laser. What can you tell me about the most important part of post-laser care?
Usually we advise patients after the laser, we need a very good sunblock to use it after the laser treatments.
Okay, could you tell me more about the different kinds of sunblock there are?
There are two different kinds of sunblocks in the market. We call it a physical block and a chemical block. The two differences of chemical block is that chemical block is like applying a lotion on your face or a body. When the sun comes into your skin, it will penetrate into your skin, and it's where the pigment melanins will go up to our skin surface layer, and you will have a pigmentation that come back. We call it rebounds. If you're using a physical sunblock is like you're wearing a clothes, alright, or our car is covered with your clothes. When the sun comes in, it will actually doesn't penetrate to our skin, it will bounce back because of the UVA and UVB.
Right. So for post-laser treatment, which sunblock type do you recommend?
Usually in H Clinic, we advise the patient to use a very good physical sunblock because even though the physical sunblock price are a bit higher compared to chemical block, but you give also anti-aging result because of the UVA and UVB, which is taking care of a collagen area, give you an anti-aging effect.
Okay, so for post-laser treatment, why is it especially important to use a good sunblock?
Because after you do a laser treatment, our skin will feel like a baby skin. It's a raw skin. Then without a sunblock, we actually cause a patient to have PIH or post-inflammatory pigmentation. A lot of patients will complain that no, after I do laser treatments, I still have pigments come back. It's because they are using a wrong sunblock. Probably this is where we need to stress to our patients that a good sunblock is important for them to use it daily.
So if someone were to walk into a store, how would they know the difference between a chemical and physical sunblock?
Yeah.
Let's say they were choosing it for themselves.
Okay, usually when the patients come in after doing the laser, I will educate them to see the different type of chemical or physical block. Physical block usually contain titanium dioxide and zinc oxide.
Okay. So when we talk about sunblock, we get a lot of numbers thrown around. We get SPF 30, SPF 50, SPF 150. Could you enlighten us on the difference between these different numbers?
Over in the Asia country, the requirements for us to apply sunblock is the minimum SPF 30. Alright. How we determine the SPF 30 and SPF 50 is the burning time of our skin. For example, if we did not apply any sunblock, we go out to the sun, under the sun, how long that our skin will get burnt. If our skin get burnt within 5 minutes, so if we're using SPF 50, we just the SPF 50 times 5, so it lasts about 4 hours. SPF 50 will last you for 4 hours, SPF 30 will last you for 2.5 hours. So if you're using higher SPF 50, we only reapply once a day, twice. That means after 4 hours and after another 4 hours. If you're using SPF 30, you have to reapply at least 3 times a day.
For post-laser treatments, is it more important to get a SPF 50 or can someone just get an SPF 30 and then reapply it multiple times?
You can just get SPF 30, but it's just that you need to reapply it every 2.5 hours to 3 hours. Of course, if you need to reapply the sunblock, you make sure that you have a very clean skin to apply the sunblock, or else you just keep on applying the sunblock on top of your dirty skin, your skin will get clogged as well.
True, very true. So in our daily lives, most of us do wear at least a little bit of makeup. Is it advisable to remove makeup and then reapply your sunblock and then reapply your makeup?
Yeah, usually sunblock we normally recommend there will be some ingredients, we call it hyaluronic acids. Alright, if you have makeups on, you have to remove it, alright, and reapply the sunblock which contain the hyaluronic acid, which is more advisable. Then you can just apply up your powder, that's it.
Oh, that's wonderful.
Yeah.
So we talked a bit about laser treatments. To my understanding, H Clinic does offer laser treatments.
Yeah.
Other than this, what other treatments does H Clinic offer?
Other than laser treatment that treat pigmentations, melasma, scarrings, and the tattoo, we also have PRP treatment, which is actually we get the patient's blood infused the blood and put it back to their skin. Yeah, that will actually help them to look much more younger. Okay, other than that, we also have just facial treatments over in H Clinic.
Tell me more about the PRP, please. How does that help with making us younger by filtering our blood, is it?
Okay, the step is that when the patients comes in, we actually clean the patient face and numb their face. And while we are numbing their face, we actually draw the bloods out from the patients. We only draw very minimum one, and we get it spin. Once it's spin out, it will separate it out, become a serum and the blood cells. All right. Then we just take out the blood serum, the serum on the plasma we call it, and we actually put it back to the patient face. How do we put it back is that we will use the laser, all right, a fractional laser, or a derma pen, a derma roller, to actually go through the patient face, like you're puncturing the holes of the face, or some of the clinics they are using an injection method, all right, and put it back. The plasma actually is like a multivitamins, right? It will go through our skin and it help to build up the collagens and whatever's we have problems like those scarrings, fine lines, you improve through actually PRP treatments.
That's amazing, especially considering plasma is also part of our body.
Yes,
so
correct.
It's like all natural kind of thing, right?
Yes.
That's wonderful. Thank you so much for your time.
Right, thank you.